Good morning to all speakers today and to all participants. Welcome to the launch of the Time to Act campaign. On behalf of the European Cancer Organization and as chair of the Emanuele Cancer Research Foundation Malta, I welcome you to the launch of the Time to Act campaign in Malta. I am Mara Luis Colero Preca, former president of Malta. During my presidency, I set up the Emanuele Cancer Research Foundation, which is a collaborative organization together with the Malta Trust Foundation, Fondazione Terzo Pilastro Internazionale, and the University of Malta. I will now give the floor to Professor Mark Lawler, who is the co-chair of the Special Network on the Impact of COVID-19 on Cancer of the European Cancer Organization. Mark, the floor is yours.
Thank you, Your Excellency, and it's wonderful to share the virtual stage with you today on what is a very important day for Malta and particularly cancer patients in Malta. And we look very much forward to the presentations, which I will start now, just to give you some background and set the scene in relation to this Time to Act campaign, which very much emphasizes that we cannot let COVID-19 stop us from tackling cancer. Next slide. One of the things we want to do before I start my presentation is really hear from you. We want this to be an interactive discussion. So if you have any points that you want to make, if you could put them in the chat box. We're really interested in feedback and comments, and also for you to get involved. This is your program, the Time to Act campaign in your country. So we very much want to work with you to really drive this for the benefit of cancer patients in Malta. Next slide, please. And just a little bit about the European Cancer Organization. We're the largest multi-professional cancer organization in Europe, 36 different member societies, very strong 20 patient advocacy groups. And really we work together to achieve improvements in cancer care. We want to reduce the burden of cancer, improve outcomes, but also, and very importantly, the quality of care for cancer patients. Next slide, please. And one of the things we've very much focused on is bringing together that expertise from right across Europe in 9 different focused topic networks. And you can see there they cover the whole pathway of cancer, from prevention through treatment, quality care, survivorship. We also really much want to focus on digital health, which is very important, particularly in the context of the European Union, and also inequalities. We want to make sure that every single cancer patient has access to the same appropriate level of care throughout Europe. And then because of the COVID pandemic, we instituted a special network on the impact of COVID-19 and cancer, which I am privileged to co-chair with Miriam Kroon from the Netherlands. Next slide, please. One of the things we did at a very early stage, and we launched it last year, was not only highlighting what the challenge was in relation to cancer and COVID, but also to actually mitigate, to actually develop a plan to build back better and smarter through the impact of COVID. And you can see there, one of the things we very much highlighted was the cancer backlog and how we address this, but also restoring the confidence of European patients and European citizens in their health services. We looked to how we can tackle shortages, address cancer workshop gaps, but also strengthen cancer systems. And one of the things that was very important in highlighting what the problem was the ability to collect data in a rapid way in order to show the problem and then look to develop solutions. So cancer must not become the forgotten sea in the fight against COVID-19. Next slide, please. We have a large number of different supporters, you can see here, right across Europe supporting this campaign. And this is very important because that pan-European campaign is how we are actually going to make sure that we address the impact that COVID has had on our cancer patients and cancer systems. Next slide, please. Today, obviously, the 14th September is very much a red letter day for Malta in relation to the Time to Act campaign. As you can see, we've already had national campaigns as well as our overall European launch by Stella Kyriakides, the health commissioner in May, which you can see there in Poland, in Italy, in Spain, and in Romania today. So Malta is the 5th national campaign, and you can see we're having campaigns right across Europe over the next couple of months. So very much bringing Europe together in a common cause to fight against COVID-19 and its impact on cancer. Next slide, please. Thank you very much.
Thank you so much, Mark, for your informative presentation. And I am now honored to introduce the EU Commissioner for Health, Stella Kyriakides, who has kindly sent us a video message for the occasion. So the video, please.
Cancer takes time away from us, our family and friends. It doesn't care who or where we are. And it will not wait for the COVID-19 pandemic to be over. But together, we can act to make a difference. For each of us, that starts with prevention and early diagnosis. They offer the best chance of keeping cancer at bay.
Yeah.
So please, don't wait either.
Okay.
Don't waste time. Time is your friend. If you act quickly enough to detect and prevent. Visit your doctor if you're worried you may have cancer. Go for your checkup. Do your screening early. Follow treatment if you're asked to. Your health services will do all they can to keep you safe. Meanwhile, at the EU, we insist that it is time to act, and we're doing all we can to reverse the cancer trend in Europe. We have put a Beating Cancer plan in place that focuses on patient needs, from prevention to survivorship. It is a plan for all Europeans. We can all make it a success and call time on cancer. It's time to act, for all of us, to act together. To find out how, go to timetoactcancer.com. Thank you.
As you've heard, a very strong message from the Commissioner, and the Commissioner has been a great supporter of cancer research and cancer care in Europe. It now gives me great pleasure to introduce the Deputy Prime Minister and the Minister for Health in Malta, Christopher Fearn.
President Emeritus, Commissioner, colleagues, good morning. Over the last 20 months of the COVID pandemic, there are a lot of lessons that we have learned. And one important lesson that we need to emphasize is that a global lack of pandemic preparedness has not only impacted the way that we have been able to manage COVID, but also directly the way we have been able to manage, or not manage to the extent that we would have liked, non-COVID illnesses, including cancer. So a lack of preparedness has not only had an effect on COVID itself, but also on the rest of our healthcare systems. Learning lessons is not enough. We need to do something about it. Of course, preparing ourselves better for the next pandemic, if and when it comes about, is essential. And I'm glad that Commissioner Kyriakides is with us this morning, because I firmly believe that the European Union has a strong global role to play in preparing ourselves for future pandemics. But the title of this conference, and I'm very glad that and honored to be part of this movement, the title of this conference is Time to Act, and the time to act is now. So not only do we need to prepare ourselves better for the future, but we need to prepare ourselves and to act better within this pandemic now. The movement of resources, the focus on COVID, the usage of our healthcare service to treat patients who are severely ill with the coronavirus was not misplaced. And as long as the pandemic continues to lift its head, we will need to use part of the resources available to treat patients with COVID. Therefore, managing the pandemic itself, as we are presently within it now, is essential. What we need to bring across to the general public and to the media is that dealing with the pandemic does not necessarily mean only dealing with COVID patients, but also dealing with the rest of our healthcare system, including cancer. So making sure that we have vaccines for everyone, making sure that we manage to keep the number of positive patients entering in our hospitals to the bare minimum means that we have enough or part or more resources than otherwise to deal with non-COVID and cancer patients. This is essential. It is essential that on a global level we deal with the pandemic as soon as possible. As communities and governments all over the world start to feel the pinch on the finances because of the economic downturn inevitably brought about by the pandemic, it is essential that all those of us who are involved in the healthcare sphere, whether as NGOs, whether as patient representatives, whether as medical professionals, whether as administrators or decision makers, we all need to make sure that health remains well funded, even as budgets around the world are squeezed. Without a healthy society, we cannot have a return to normality. And as we continue to deal with the effects of the pandemic, both directly and indirectly, catch-up of cancer treatment and other non-COVID diseases is going to require more and more resources. In conclusion, I thank you for being with us today for this important meeting, and I wish you well for the rest of the conference, and as our President has said, now is the time to act.
We thank the Deputy Prime Minister of Malta, Mr. Chris Fehn, for his important contribution. It is now time to introduce the video of the campaign, Time to Act.
COVID-19 has disrupted our lives and had major consequences for cancer care and cancer patients. While we may be waiting for the pandemic to end, cancer won't wait. So it's time to act. Taking care of your health and keeping cancer in check is as important as ever. Don't let COVID-19 stop you from going for regular screenings or treatments. The earlier the diagnosis, the better chance of treating cancer. A visit to your doctor could be life-saving. Are you bleeding when you go to the toilet? Do you have a lump in your breast? Difficulty swallowing? Unexpected weight loss or other warning signs? Don't wait. Contact your doctor. Don't delay your appointments and don't hesitate to plan new ones. Make sure that you go if you are called for a screening appointment, HPV vaccination, or ongoing treatment. Because cancer won't wait, neither should you. Health services continue in the safest conditions to provide you with the care you need. It's time to act before it's too late. Don't let COVID-19 stop you from tackling cancer.
And now I have the pleasure to introduce the first session for this morning's event, titled European Future Without Cancer, Beating Cancer Despite Pandemics. As our first speaker for the session, I introduce the chair of the EU Cancer Mission, Walter Riccardi, who sent us this video message.
It's my pleasure to give you all the best wishes for Time to Act. Don't let COVID-19 stop you from taking cancer in Malta. As chair of the mission board, I have coordinated a fantastic group in the past 2 years. We have produced important, bold recommendation, and we are very happy that the whole Commission and Member States have welcomed our conclusions in a way that is productive for tackling cancer in the future. We know that the President von der Leyen will endorse and start the project of the 5 missions in her speech on the State of the Union in September. And it's important that we do that now, because after almost 2 years of pandemic, it's important that we don't focus only on these very important emergencies, but we don't neglect the patients, the people, the prevention, the diagnosis, the treatment, the rehabilitation in the field of cancer. I'm sure that Malta will play an important role in these activities. I'm sure that you will be taking responsibility for the implementation of the mission board actions, but also for the implementation of the European Beating Cancer Plan. It's the first time that Europe as a whole, Europe together, is going to tackle these important threats and is going to discuss, promote, activate important measures for the most important topic of human life. Certainly cancer, the choice of cancer is of course focusing on this disease, but can be also a kind of paradigm, a kind of standard for other diseases. So it's very important that this is going to have success. As success, I'm sure you will have your launch today, Time to Act. It is time to act. All the best.
I would like to thank Mr. Walter Riccardi, and now I would like to introduce Mr. John F. Ryan, the Director of Public Health at the European Commission.
Good morning, ladies and gentlemen, and thank you for your kind invitation to address your campaign launch in Malta. Like you, the Commission is also deeply concerned about the devastating impact of the COVID pandemic on cancer care and services. Research has found that over 1 million cancer cases could be undiagnosed in Europe because of the COVID pandemic. And this is, of course, a huge problem for the patients concerned and for our health systems. The pandemic constitutes an unprecedented challenge, not only for our healthcare systems, but also for our societies and for the economy at large. The European Commission has mobilized all means available at EU level to support the member states and stakeholders. The experience with the impact of the pandemic has shown the importance of reinforcing coordination and establishing effective partnerships in the health sector.
Can you hear me?
It also showed us the need to focus our attention on vulnerable populations, and the European Cancer Plan takes this into account and takes the lessons of the COVID outbreak into account in order to develop contingency planning.
Can you hear me now?
To respond to similar events in the future. To guarantee smooth and consistent implementation of the Cancer Plan, we're working closely with all groups concerned, for example, the health and research ministries in particular, but also all of the policy departments in the Commission who might have an interest in the prevention or treatment of cancer. And last but not least, groups such as yours in the European Cancer Organization through our online stakeholder platform, which we're hoping now to really operationalize in the coming weeks with detailed discussions with stakeholders on individual items on the cancer plan, so as to make sure you're fully involved in the implementation process. Now, as regards the financial instruments, we have the EU for Health programme and the Horizon Europe programme. And both of these programmes, together with other funding sources, have been brought together, and we have earmarked a budget for the cancer plan of 4 billion euros. And we have already launched in July of this year a first round of calls for proposals, and a second one is following in a few weeks' time. I think there are 12 different initiatives which will be launched in the first year, so that's really starting with a bang, I would say. We have already included, as part of this package, 4 grants, for example, for the setting up of a network of EU cancer youth survivors and an interspeciality cancer training programme. And both of these initiatives, I hope, will provide support, first of all, to youth and to their needs as cancer survivors, to young people. And secondly, then, this huge gap which we have, and it's going to get worse, on cancer training, cancer professional training for cancer specialists. And here, this is a mixture of increasing demand for cancer treatment. It's also a demographic problem. It's a general problem for health workforces. So we hope that by injecting investment in the area of cancer training, that this will also kickstart some European activity. And we also have grants which are being published to support HPV vaccination in the member states, and on the setting up of a structural initiative, which is the network of comprehensive cancer centres. The Commission has really tried to not lose any time from the adoption of the programme to the rolling out of our financial instruments. In addition, you've seen that the Knowledge Centre on Cancer, which is an initiative bringing together a whole series of different data sets and registry information on cancer, this was launched already in June of this year. And later on in September, you'll also see the initiative being launched of the Healthy Lifestyle for All, focusing on physical activity, on good nutrition, on moderate use of alcohol and avoidance of tobacco consumption. So these are initiatives which I wanted to mention to you because they're concrete examples of where the Europe Beating Cancer Plan is already delivering, I would say. And of course, we need to be sure that the lessons learned from the COVID outbreak have been learned and are included in these different projects so that we can make our approach as sustainable as possible in case a similar event were to occur in the future. I should mention as well that the Cancer Initiative under the Horizon Europe Research Programme is also in the process of being finalised at the moment, and that will also bring a huge stimulus to research and research activity in the area of cancer, and I'd be very happy to talk to you more detail about that as soon as it's been adopted. So initiatives such as the one which you are launching today on Time to Act are really needed to guarantee the restoration of cancer services and to address the current backlog which exists in many member states. When it comes to cancer, of course, there's no time to waste, and I wish you every success with your campaign, which we fully support. Thank you very much.
We thank John for his contribution, and now I have the pleasure of welcoming Dr. Roberta Mazzolo. Dr. Roberta Mazzolo was first elected to the European Parliament in 2013, becoming one of Malta's first Maltese female Member of Parliament, European Parliament. She was re-elected in 2014 and then again in 2019. In 2020, she was elected as the very first Vice President of the European Parliament, becoming the first Maltese national to hold the post. Professionally, she's a lawyer who has specialized in European law and politics. Vice President Mazzolo is the head of the delegation of the Partito Nazionalista within the EPP group. She's currently a member of the Civil Liberties, Justice and Home Affairs Committee and of the Delegation for Relations with the United States. Vice President Mazzolo is a substitute member on the Committee for Environment, Public Health and Food Safety, the Special Committee on Artificial Intelligence in the Digital Age, and the Delegation for Relations with Japan. Roberta, the floor is yours.
Thank you so much, Your Excellency. Let me say, first of all, that as the first Vice President of the European Parliament, we are committed not only to fighting cancer, but also to beating the disease. In 2020, 2.7 million people in the European Union with the disease, and another 1.3 million people lost their lives to it. The pandemic has meant that many, many more have to deal with delays, cancellations, loneliness, the disruption of treatment, the delaying of diagnosis and vaccination, and the affecting access to medicines. It has made what is a terrible situation far worse. And our message today is that this cannot continue. Europe's Beating Cancer Plan is a key pillar of the European Health Union, presented by the Commission of the European Union, of the President of the European Commission, Ursula von der Leyen, in November 2020, that calls for a more secure, resilient and prepared European Union. And I hope that in tomorrow's State of the Union speech that we will all hear in Strasbourg, where we are today, we will see a part dedicated to beating cancer. The European Union has been working on cancer for decades. Its actions, particularly on the tobacco control, the Commission published today, in fact, a new survey on attitudes of Europeans towards tobacco and electronic cigarettes and protection from hazardous substances that have saved and extended many lives. The Commission also presented in February Europe's Beating Cancer Plan, with new technologies, research and innovation as the starting point. The Cancer Plan sets out a new EU approach to cancer prevention, treatment, as well as care. It will tackle the entire disease pathway from prevention to quality of life for cancer patients and survivors, focusing on actions where the European Union can add the most value. This plan will be supported by actions spanning across policy areas from employment, education, social policy and equality through marketing, agriculture, energy, the environment and climate, transport, cohesion policy and taxation. In fact, the Cancer Plan is structured around 4 key action areas with 10 flagship initiatives and multiple supporting actions. It will be implemented using the whole range of Commission funding instruments, with a total of 4 billion euros being earmarked for actions to address cancer, including from the EU for Health programme that we hear a lot about, Horizon Europe and the Digital Europe programme. Now, in addition to severely affecting the lives of patients and those around them, cancer has had a huge impact on our health systems, our economy, and on the society at large. The overall economic impact of cancer in Europe is estimated to exceed 100 billion euros annually. And without conclusive action, by 2035, cancer cases are estimated to increase by almost 25%, making it the leading cause of death in the European Union. My appeal to member states of the European Union is to join forces and fight cancer by stepping up our cooperation in the field of research, prevention, early detection, and patient support. And I am glad that Malta, my country, is leading in this field. The European Parliament set up a special committee to see what Europe can do to help Europeans fight and beat cancer. The aim through the new committee is to gather support for the 10-step European master plan to fight cancer. There are 4 main areas of this committee's work that are based on prevention, early diagnosis, treatment, and care. And those areas represent the strategic approach that the European Union has taken in order to beat cancer. So in a nutshell, what we need is more and better cooperation between research centres across the European Union, more money for cancer research, and to make sure that the same quality of access to such research and treatment exists across Europe, across all the countries of the European Union. We cannot allow the pandemic to delay things any further. This is what we are working for. We can beat cancer, and ours has to be the generation that will do it. Thank you very much. Over back to you, Mary-Louise.
Thank you so much, Roberta, for your deep sense of commitment. Thank you. And now I have the pleasure also of welcoming another Maltese MEP, Cyrus Engera. Cyrus Engera is a member of the European Parliament, who is a member of the Progressive Alliance of Socialists and Democrats. He sits on the Environment and Public Health Committee, the Special Beating Cancer Committee, and the Committee on Civil Liberties. In his work, he is mainly focusing on pediatric and lung cancers, early screening and rare diseases, with a focus on accessible and affordable healthcare. And now let us watch his video message.
I would like to start by thanking the European Cancer Organization and the Time to Act campaign for inviting me to say a few words during this online event. It has almost been 2 years now from the onset of COVID-19, and we have seen the way in which it managed to touch upon other health services and the lives of patients all over the world who are undergoing treatment or seeking access to take care and screening services. This was no different for cancer patients, where we have seen that only in the first year of the pandemic, clinicians all over Europe saw 1.5 million less cancer patients. We are also aware that 100 million screening tests were not performed in Europe for reasons relating to the pandemic, and 1 million cancer patients could be left undiagnosed in Europe in view of the backlog in screening tests, reduction and delays in referrals, and the limited availability of resources in the health sector during the pandemic. COVID-19 has led to a reality where 1 in 2 cancer patients in Europe did not receive the surgical or chemotherapy treatment required, and 1 in 5 are still not receiving it till today. As we know, screening and early detection are essential for improved outcomes and survivorship, and therefore we cannot let any more time go to waste, and we need to act now. I therefore call all governments across all EU member states to support the reactivation of screening programs and cancer services, and to invest in campaigns which give the necessary reassurances to European cancer patients regarding the safety and the necessity of these programs and services. We cannot let this pandemic cost us any more lives, and it is therefore time to act to build back cancer services across Europe, to provide cancer patients with the quality care and treatments that they deserve, and to restore full access to screening for our communities. Let's build back what we have lost together.
Thank you, Cyrus, for your message. And now I would like to invite everybody to watch a short video clip.
I hope you found that video clip informative. We now move into the second section of the programme, the impact of COVID-19 on cancer services. And I'm going to start this session by just presenting some data that I think is really important. One of the things we've found is that a data-led response to understanding what the issues are in relation to COVID and its impact on cancer and cancer services, and then using that data to give us intelligence to mitigate against the impact and to move forward, as we've already had for a number of other speakers. We know from obviously the COVID 7-point plan that we launched last year, it's really important that we drive data. Cancer won't wait, so we can't wait either. You can see here a number of different initiatives that have really highlighted the importance of data and how that has been used then to help us in our fight against COVID-19. Next slide, please. One of the things we did was we needed to commission data from an all-European basis, so right across Europe, in order for us to drive this policy response. And so we looked at 6 different parameters where data could actually inform us of what was happening at the European level. Next slide, please. And some of this data is really quite shocking and really got us to stand up and take notice. And led to the start of this campaign. So you can see there, for example, the impact on screening of COVID-19. 100 million cancer screening tests were not performed in Europe as a result of the pandemic. That is not a misprint, that is the actual number, 100 million. And that then led obviously to the next impact there, where we see 1 million cancer patients across Europe could be undiagnosed due to the impact of COVID-19. So we may have as many as 1 million people right across Europe who are walking around with a diagnosis of cancer that they don't know about. So therefore, it's critical to act on this data, and this forms the basis of the Time to Act campaign. Next slide, please. What we also see has had an effect on treatment, particularly in relation to surgical and chemotherapy treatment. We see 1 in 2 cancer patients did not receive their surgical or chemotherapy at the appropriate time. 1 in 5 are still not receiving it, but also the impact on health workers. And this is something we really need to take notice of. 4 out of 10 feeling burnout and 3 out of 10 showing signs of depression. And then finally, the impact on citizens and on cancer patients, fear of contracting COVID-19, less likely to attend screening appointments, go to hospitals for early stage or asymptomatic cancer treatment. So all of this data has fed in to give us that vital intelligence that has underpinned the Time to Act campaign. I'm now going to transfer to one of the first speakers in this session. Again, one of the things we highlighted, not only the impact on cancer treatment, but also on cancer research. And we're now going to hear from a cancer researcher, Christian Steri, who's a researcher in the University of Malta. Christian, the floor is yours.
So actually, when I was asked to give this talk, I wasn't being asked as a researcher, but actually as a clinician within the lab that is giving a service, and that is what I put on my talk about. So from the research, just to give you a bit of information from the research side, we were not greatly impacted. Actually, our research continued because it had already started. Obviously, it didn't start new. So if I can have my slides, please. Okay, so basically, apart from being a researcher, I'm also the consultant in charge on the molecular genetics service, and this service is a lab that okay. So it is within there's some delay. So it is within the university campus, but it's part of Mater Dei Hospital. It's around 110 square meters in size, and it's manned by 8 people, all majority of which masters, but we also have PhDs, and it's equipped with latest equipment that we can have. And what we do is really we have a general genetics service, so we go on thalassemia screening, we have molecular genetics, we have also involvement in the assisted reproduction technology, but a lot of our work is now based on cancer genetics, both from the genetics point of view, from the inheritance, but even more important, from the somatic testing for targeted treatment. And this is where my talk is going to be mostly concentrated. The challenge that we had met last year in the beginning of COVID was actually that because of the techniques that we use are very similar to the SARS-CoV-2 testing, we had some changes. Our lab was transformed into a backup lab for the molecular diagnostic lab, which is the main lab that did the swabbing. In a way, it was a good thing that nothing really happened, and we just remained as a backup. So we didn't need to go into to be utilized as such. But in the meantime, 2 members of the staff, so around 25% of the staff, were actually transferred to the molecular diagnostic lab. So we lost 25% of the staff. There was also a risk that 1 member of staff being infected, and the rest would be quarantined and would have been stopped from working for 2 or 3 weeks. And there was also the need for social distance and other similar precautions. So these were our challenges in the beginning, in around March, when we took some actions. And the actions that we took were basically, the first thing we did is to look at our test group. We divided them into 3 groups, the red and the amber and the green. The red being the essential test, and for us the essential tests were actually the cancer diagnostic and genetics. The amber were those that were semi-essential, the thalassemia testing and screening, and the green were those that were not really non-essential. For example, the ART-related tests were not essential even more because the IVF and other procedures were suspended during last year. So we could divide this. So we did concentrate, and we did say that red was essential, and that is what we couldn't stop. Other measures that we took were actually, we divided our staff into 2 shifts, a day on-site and a day remote. So this limited the risk of all staff being quarantined. Remaining staff were actually spread in all the labs and the offices, so each was working in a separate room. Breaks were spread in such a way as not to meet in the common room. There were masks, face shields, and gloves as usual, and there was also the body temperature being recorded on entry. So these mitigation measures made sure that we did not have major problems from the staff, but they did start having some psychological pressures on the staff, and that is something which is important to look. So the result is that actually the lab never closed, even though we had 3 members of staff that had to quarantine in 3 different occasions. Essential tests not only remained the same, but in some cases increased in number. For example, the cancer somatic testing, which required, which is required for treatment, actually doubled or almost doubled in 2020, and it will double again in 2021. The cancer genetic tests also increased in number or remained stable. So these essential tests were there, and the AMBER test could continue with some delay, but acceptable delay. The major issues that we had, or as a conclusion really, that with well-planned mitigation measures, this reduced the disruption of the service to a minimum. So in a way, this is a good thing. The major impact was actually on the human psychological toll. The lack of social interaction during the peak of the pandemic was something that affected us all. It increased the risk of burnout on the staff as the workload increased or the number of staff decreased. And in 2021, there's an increased pressure because obviously now we're picking up backlog of tests that we had to do. With all the staff now members being fully vaccinated and certain mitigation measures set in place, we should have or we are actually seeing ourselves slowly returning to normal. So in a conclusion, I would say that overall, I have to say this is basically, these are my staff, and I have to thank them because they were really all wonderful during this teamwork, and without their effort and their sacrifice, we wouldn't have worked so well. But as a conclusion, I would say that if one had to look and then one have to really think and go into looking at how the service could continue and make some disorders, unfortunately, we need to choose, but I think that cancer is an important aspect where people have to act quickly, because the quicker you have, the quicker treatment you have, the quicker diagnosis you have, the better is the outcome. With certain mitigation issues, this has been overcome. So from our point of view, from a genetic service point of view, we have had no big issues, but because I think we worked well in this field. So I thank you for this opportunity to present this, and Mark, I will leave now back to you, Mark.
Thank you very much, Christian, and really informative presentation there, and very interesting, highlighting the issue in relation to the impact on the staffing, echoing the study that we did at the European level, seeing in medical staff, obviously laboratory staff were also very significantly affected. So thank you very much for that presentation. I'd now like to introduce Gabriel Zarafa, who's the acting treasurer of the Maltese Oncology Nursing Association, to give their perspective. Thank you, Gabriel.
Hello to all, good morning. Thank you for the invite and the opportunity to speak today on behalf of the oncology team today. I'm not just a Maltese Oncology Nursing Association representative, but I'm also a nurse who has been working here for over 6 years now. I know that the allotted time given to me is quite short, so I'll be brief in my discussion. And I will start off by saying that the impact of COVID-19 has been felt here quite so in Malta. We, as a health institution in Malta, just like the international community, we had to prioritize and shift our focus on our needs on COVID-19. COVID-19, we wanted to prevent the spread of the infections throughout the community. So we wanted to avoid as much as possible an acute rise of hospitalizations due to COVID-19. So we put in place policies and procedures to not overburden and overstress our hospital national system, so as to prevent any collapse. So what we did was we had to postpone, withhold certain medical and surgical procedures, one of which was cancer screening, just like the international community, such as endoscopic procedures, fecal occult blood tests, MRIs, PET scans, CTs, mammography, cervical screening. In terms of screening, we had to postpone them. And as rightly mentioned so by the speaker, as you have said, Mark Lord, screening has stopped. In fact, according to the American Cancer Society, just a recent study they published in August 2021, screening went down by 80 to 90% when comparing April 2020 to 2019. That subsequently leads to a lack of diagnosis. In fact, it went down by 25 to 50% of diagnosis when comparing the same time period in terms of breast cancer, colorectal cancer, pancreatic cancer, and cervical cancer. And consequently, with the lack of diagnosis and the lack of screening, we will see the impact later on. We are seeing the impact just now when screening has now resumed, and people are less fearful in attending cancer screening because we have managed to vaccinate 90% of the populace in Malta. We are starting to giving the third booster to the vulnerable and elderly. So people are restarting going to the health services. We have put policies and procedures in place to safeguard the health staff and those people that attend the healthcare clinics. So people are now suddenly going back to screening themselves. We are seeing an acute rise suddenly, whereas before in the previous months, we were barely seeing any new patients coming in. Now we are seeing an acute rise of patients requiring cancer services. We are trying to effectively and efficiently allocate our resources to manage this sudden and abrupt rise in cancer needs. And in fact, according to the National Cancer Plan that was done in 2017, we should have seen over 2,100 newly diagnosed patients this year. However, that fact and figure is surely to change because of the lack of screening and the lack of diagnosis. And we'll start, and as I said, we are starting to see that impact now. We'll soon start seeing it now. Local facts and figures will be discussed, I think, by another speaker today. However, the acute and reassuring sort of way is saying that the measures will be seen accordingly. Now, another issue that was seen is that we had to change our treatment modalities in certain cases, such as palliative treatment, immunotherapy, and cancer and chemotherapy. We had to postpone and withhold giving that treatment in palliative cases where the aim was to slow down disease progression, to alleviate any debilitating symptoms. But at the time, we had to measure the risks and benefits. Risks at the time were much more higher. We saw that complications would have risen. So we stopped giving chemotherapy in certain cases. And in certain cases, we even prolonged our treatment plans. We know that immunotherapy and chemotherapy and radiotherapy is given into a set of cycles according to the protocol and the disease at hand. In certain cases, these cycles in between each cycle, in between each treatment, there is a recovery period. 1 week, 2 weeks, 2 weeks, depending on the protocol disease at hand. However, in certain cases, we prolong them. We double the time of recovery from 1 week, 2 weeks, 2 weeks, 3 weeks, so on and so forth. Why? We wanted to prevent any complications from arising requiring hospitalization, such as immunocompromised statuses, neutropenia and neutropenic sepsis, and other complications which could have left our patients going into a hospital situation which was stressful and overburdened with COVID-19. So we wanted to avoid the scenario of an immunocompromised patient acquiring COVID-19. And we did not want to increase the workload, increase the stress on the healthcare system with such scenarios. So we try to maintain a positive environment by reducing as much as possible these scenarios. Also, one of the facts is that the patients have felt the impact of COVID-19. Obviously, with cancer, it's a delicate issue because the treatment makes you much more susceptible to infections, getting infections. In fact, the people that they were coming here, they felt the fear and stress of such a situation. We try to help them by discussing the scenario on self-care and self-help, even the fact that they could not meet their family members because of social distancing and the fact that everyone was in lockdown. So we try to mitigate that fact by creating a more positive environment within our oncology center and creating that therapeutic relationship with the patients. I probably am over my allotted time, so I will conclude here. Thank you all for the invite once again, and hope we will get back to normal very soon, and good day to you all. Thank you.
Thank you very much, Gabrielle, and really highlighting, at the cold face, the work that was done to mitigate the impact of COVID-19. So thank you very much indeed for that. I now come on to my next speaker, Neville Kaleja, who's the Director of Health Information and Research at the Ministry of Health. And we talked earlier on about the importance of data and turning data into intelligence, and we'll hear some more in relation to that as well from Neville. Thank you.
Thank you, Professor Lawler. I'll do my best to illustrate the situation in Malta. So basically, first and foremost, as Gabriel was trying to explain, yes, indeed, I'm not sure, I might have clicked one slide too far. Yeah, okay. Yeah, as Gabriel was explaining, this is something that has been observed around the world. I borrowed this picture that has been quite viral within the medical circles, actually, which is describing what we could call different pandemic waves. So the pandemic itself is the first wave in this figure, but we clearly are seeing the effects on other conditions that have been affected as a collateral damage of both the fear of contracting COVID-19 and possibly losing one's life, and also of curtailing healthcare services in some settings. Needless to say, the one that will be with us for longer is probably the mental health wave, because we will be seeing the effects of this for several years to come. We have had this also referred to by the WHO regional director earlier on this year, who did sound the alarm on this as far back as April this year. I have figures, unfortunately, and that is a casualty, as also Professor Sherry was explaining earlier. In a small country like ours, the response to COVID-19 meant that we had to pull in any resources we had. And there are some casualties to that. One casualty is, in my case, the production of as much epidemiological output as we used to do in pre-COVID, so to say. So, and here I must thank my staff, my colleagues, who have kept the data collection of their individual epidemiological register, including the cancer registry. But given that they are also part of the COVID response teams, unfortunately, the outputs of those registers have been less than usual. So I think what we've done is to prioritize the data collection as much as possible, with a view to being able to catch up on the outputs at a later stage when there's less work on the COVID response team. But we have figures here from the UK, which are also supporting what Gabriel was saying. I think he already referred to something like this. And we can see a drop in the encounters, the healthcare encounters for various hospitals in the UK. This is another separate study published by Nuffield Trust that shows, again, across the UK by different cancer sites how appointments have dropped. And you might also notice that some sites seem to have recovered much quicker than others. Possibly those with a lower recovery rate seem to be the more the patients that consider themselves to be more fragile, possibly, or more serious. So they are still very fearful of approaching a healthcare service or of leaving the household altogether. Okay, same with the first treatment, so be it radio, be it surgical, be it chemo. This now brings us here in Malta. This is sort of the timeline of how the epidemic has looked like over the past 18 months or so. So at the beginning, obviously, we didn't know what we were dealing with. As soon as cases started rising, there was pretty much a lot of closure of various sectors, including elective healthcare. Elective healthcare in Malta, luckily, was closed for a period of only 6 weeks in 2020. And in fact, our first transition strategy did prioritize the restarting of all elective healthcare as the first step. And that, I think, has paid off because whilst the fear would still have been there, of course, to approach healthcare services, at least those who did pluck up the courage to actually contact the healthcare services could do so. Then obviously, as things went by, the waves got worse, so to say. Maybe people got a bit more accustomed to COVID, as we're seeing also, nowadays, I guess, if we walk outside on the street. And we had also various events happening along the way that facilitated the spiking or the dropping of COVID cases. On the whole, however, as also Gabriel alluded to earlier, the policy here in Malta has been to try and invest as much as possible at the community level control of infection to A, avoid overwhelming healthcare services, B, avoid the disruption of elective healthcare services, and C, avoid total lockdown as much as possible. And in fact, Malta never had actually complete lockdown, same as several other European countries have. We got close at one point, but we never had total lockdown. And as you can see, it sort of paid off because the positivity rate, which is possibly the more comparable indicator when comparing the epidemic burden, has remained always under 7%, even at the worst of the epidemic, as opposed to other countries where it spiked up to 50–40%. So that has helped to avoid the overwhelming of our hospitals. This is indeed what I've just explained earlier on. So in terms of disruption of elective healthcare, what we saw this period in 2020, we did see, however, still fear preventing patients seeking healthcare services. Several cancer patients sought follow-ups on the phone, and this again is thanks to the people in the oncology center that sort of met this demand as much as they could. So they did deliver a lot of follow-up care on the phone, but obviously first encounters, it would be a bit difficult to do that on the phone. Before we go to the hospital level services, however, it's good to speak a bit about screening services. We know as at May 2020 that we did get a fairly sharp drop at that point in time in people's acceptance of invitations for screening in all three modalities. In fact, this morning I managed to get some figures of acceptance rates of the cervical and the colon screening programs. And we've seen, unfortunately, a bit of a deterioration across from 2019 to 2021. In cervical cancer, in fact, it was 39% in 2019, went down to 34% in 2020, 33% in 2021. And in fact, the screening center is right now actively trying to recover and re-invite those individuals who did not accept the invitation earlier on. In colon, then, we saw a similar drop from 63 in 2019, 62%, to 60 in 2020, and down to 50 in 2021. So again, we've got a recovery program in place happening there. If we had to look now at referrals to hospital, It's a relatively good news. So we're talking about new case referrals here. And this, I have to thank here the clinical chairperson of the oncology services for providing these figures. It appears that the total referrals in 2020 are very close to the total number of referrals in 2019. These are new case referrals, so new diagnoses. We usually see a slight increase from one year to the other. So there's definitely still a drop. A drop is there, but maybe not as marked as we have seen in other countries. And I think this is my penultimate slide showing you how radiotherapy again, this first encounter also was at par with 2019. So 2021, we don't yet have the figures that I have shown you. I've only managed to get the screening services yet. But we're expecting, unfortunately, to see similar issues in 2021. The vaccination program has helped a lot in the building of confidence amongst the population. So in conclusion, basically we have a situation on our hands which needs a highly dynamic response. Effectively, if you delay your response to COVID-19, it could be deadly, as in killing people with COVID-19. On the other hand, if you delay recovery, it can be deadly because of the other conditions. So it's a very tight balance. I think continuing with the management of the pandemic at community level, as has been done to date, is probably the best strategy for recovery in these services. And as I said, one specific quality, I guess, one specific impact that we see in small countries like ours is that some supporting services like epidemiology might have to be sort of cut back in order to redeploy public health staff for COVID-19 response. So that's it from my end. Sorry if I took more time than expected. Thank you.
Thank you very much, Neville. Really interesting presentation, and very much sharing that cancer intelligence data, which is really important to drive change. So thank you very much indeed. I now invite you to just look at a short video clip and then we go into the next session.
I would like now to welcome all of you to the third and final session for this morning, where we will discuss patients and center of oncology care, from prevention to access to innovations. I'm pleased to give the floor to Rowena Enriquez, Vice President of Europa Donna Malta. Europa Donna Malta is the longest standing breast cancer organization in Malta, and indeed one of the pioneers in the area. Rowena is a survivor, and she's here today to tell us her story. Rowena, the floor is yours.
Good afternoon, and thank you for inviting me to share my own experience battling breast cancer for the second time during COVID-19 pandemic. I am Rowena Enriquez, and I am also a Vice President of Europa Donna Malta, an NGO which offers support and awareness on breast cancer. I was first diagnosed with breast cancer 11 years ago, at the age of 29. I was already married and raising two very young kids, aged 3 and 6. It was different back then, as I had all my close family and friends by my side, and all the help one needs, even if it's just sitting by my side while having chemotherapy. I went through lumpectomy, chemotherapy, radiotherapy, and Herceptin. After getting my life back together, unfortunately, last September, a few months before my big 40th, I was given the bad news again, that I have breast cancer again in the same exact scar tissue of my previous. It was devastating news. My world fell apart once more. And after all those years, treatments, still on tamoxifen, with no family history and a genetic negative result, I thought I was in the clear. Well, being the current situation of this pandemic, first thought that came to mind was that things will be different this time round. I was scared and petrified. What if I get COVID? What if I cannot be operated due to high cases? When given this news, I was at home with my kids, now aged 15 and 18, and are both homeschooling. I had no idea how to deliver the news again to my parents, as they are older now, and I know it's going to be hard for them, not being able to be around as much due to COVID. Obviously, I was longing for a hug from my parents, but that was not possible. In times like these, when one needs more affection, I couldn't get. I was desperate for comfort and reassurance from my loved ones, but because of COVID, obviously I couldn't. Even just a simple hug or a shake of hands was petrifying. Preparing for the operation was a challenge. Everything needed to be done alone. Pre-ops, procedures, and surgeon appointments. I had to attend all alone, which was quite scary. Being able to absorb all that is being told and explained to you by yourself is not easy to take in. Your mind is already trying to take in all that is going on. October 15th, Breast Health Day, was my operation. This time my operation was more complicated. Spent a good week at hospital recovering, and I must say that those were the most long, loneliness days I ever had. Being away from my kids and simply just not having a loved one there by your side was tough. Only one family member was allowed for only 1 hour during visiting hours, which passed by a blink of an eye. Thank God for technology these days, as I could at least pass the time by connecting and seeing my kids and parents online. Once back home, my husband had to start working from home too, as to lower the risk of getting infected with COVID and bringing it home. A few weeks after, I was given the results of what's to follow after my operation. It was hard going to the professor or alone and hearing what I was dreading to hear. Unfortunately, it was chemotherapy again, and with all the side effects once again. For my 40th birthday last November, I was having my first cycle of chemotherapy. Not exactly the way one would want to celebrate this milestone. They say life begins at 40. But instead of surrounded by my loved ones, I was all day at Oncology alone, only returning home in the evening, spending a lovely eve with my husband and kids, trying to put on a brave face. Having chemotherapy every week meant I had frequent trips to the hospital. COVID swabs had to be done every week, which are not pleasant, and one had to wait in very long queues. Life changed for us again. I was allowed to continue working from home to lower any chance of getting infected. Kids had to adapt constant homeschooling, which was a big challenge, especially for my eldest who was sitting for his A-levels. Having online private lessons to catch up on what they were missing from school, which added to more expenses during these difficult times. And obviously missing out on extra activities as their teenage friends. Not easy at all on them, being at that age when one wants to hang around their friends mostly. Although support was reached virtually when possible, it's not the same when one mostly needs it. I longed for a few sessions with my psychologist to help me deal with meeting, but meeting in person was not an option. Even a simple chat with a friend over a coffee was a definite no. Me being the vice president of Europa Donna Malta support group, we still managed to keep our monthly meetings virtually, with members going through or went through similar experiences. Being I had the experience of going through this battle under two different circumstances, I must say it has been very challenging. Yes, I must admit that friends and family helped how they could, especially when it came to shopping and daily needs. My doorstep had become my living room, as that was the only way we could have a little visit and chat with our loved ones at a distance. I must say that due to this pandemic and me being vulnerable, it has affected us as a family more. Yes, we got to spend more time together as a family, but mentally it has affected each of us differently. I cannot help but feel guilty because of my situation, as not only was my life put on hold, just like it did 11 years ago, but even my kids and husbands. Thanks for listening, and it was a pleasure sharing my experience.
Dear Rowena, thank you so very much for being brave and sharing your personal experience with us. I now welcome Gertrude Buttigieg, Chairperson of Malta Health Network. The Malta Health Network has been the voice of patients in Malta for over a decade by promoting the European Charter for Patients' Rights. Its work was constantly supported and guided through its partnership with the Active Citizenship Network. Gertrude has chaired the network for the last 10 years. Gertrude, the floor is yours. Thank you.
Thank you very much. Good afternoon. It is an honor for me to be invited to address such a high-level event. And being the last speaker after such a lineup is very difficult. But it is an honor for me to represent the network and be a voice for the patients. From a survey we carried out last year, we estimated that we represent 12,000 families. We stress on families, not patients, as we know that any illness or disease affecting a person will to an extent affect the life of those around him or her. The Malta Health Network has been promoting patients' rights since 2008, and we cannot but link the aims of this campaign, addressing cancer care during COVID era, without linking patients' rights. The right to preventative measures is considered of utmost importance, and we have promoted this earlier on this year during our contribution for World Health Day, when our message was health is more than COVID. We strongly believe that prevention campaigns, including targeted education campaigns and policy initiatives to reduce the risks related to cancer, are very valid investments. By making this statement, I am certainly not stating anything new. This was recognized as a principle in the National Cancer Plan 2017-2021. Preventative strategies were aimed to address the exposure to tobacco, alcohol, infectious agents, and occupational hazards, together with weight problems and mobility issues, which are all known contributors to cancer. Tackling high-risk populations, including individuals with mental health problems, was also considered one of the preventative measures. Whilst we all recognize that COVID has hit us like a whirlwind, and we are not yet sure where and when we are landing, our health conditions like cancer are not waiting. We know that some screening programs, as already mentioned earlier, went on pause mode, but we strongly advocate for these to start in full swing again, as we do not afford to have late diagnosis at the detriment of outcomes of care. With this, I would like to address our general population to accept any invitations to take up screening for any type of cancer, and where in doubt, to seek the advice of professionals or organizations such as those members of the Malta Health Network, and not Dr. Google. Please do get through to us, and we will direct you to people who can guide you and help you to access the right services at the right time. Speaking of access leads to another important right, the right to access. We know that the past months, restrictions due to COVID have limited face-to-face appointments between professionals and patients. We have seen technology facilitate this for many, but certainly not for all. We know for sure that there are several situations where, due to digital illiteracy, the patients fell through the net and may have been lost to the system. With this, I appeal to the health services and professionals to look out for these people before it is too late. Let us not assume that everyone is literate, health literate, and digital literate, as we know that not everyone is, and thus we may fail those who are at most needed. The last aspect I would like to address is the right to avoid unnecessary suffering and pain. We know that cancer may bring along physical and emotional pain. May I appeal to try to facilitate the process as much as possible, to have one-stop shop for persons with cancer and their carers. It is not physically possible to cope with the illness whilst being made to run from one office to another, one building to another, at different localities to get signatures, collect permits, collect medicines and equipment, and beg for others. Whilst one cannot minimize the suffering of patients, I really want to appeal for sensitivity towards the carers. I would like to conclude by referring once again to the National Cancer Plan. It speaks of the participation of patients in the care process. Please make this a mantra. Let there be a seamless approach to care where there are no barriers, but a collaborative approach between all systems for the best possible quality of life for the patient, with hopes for survival and life after surviving cancer, or a life where whilst living and fighting cancer, one has the necessary care and support to live with dignity. Once again, thanks for the opportunity, and let us all hand in hand take this time to act cancer. Thank you.
Thank you so much, Gertrude, for your contribution. And now I give the floor to Professor Mark Lawler.
Thank you very much, Mary-Louise. And really, both what Rowena and Gertrude said in the last two presentations really is the essence of where we are today, and the absolute importance of patients being embedded and being empowered and feeling empowered to contribute to our fight against COVID-19 and its impact on cancer. This is incredibly important, and it very much aligns to what I'm going to talk about now in relation to the European Code of Cancer Practice, which we've developed over the last 2 years in the European Cancer Organization. Next slide, please. The European Code of Cancer Practice really is absolutely about what Gertrude talked about, patient rights. So rights in relation to access, information, expertise, multidisciplinary care, but also things like quality of life, integrated support, palliative care, and critically, survivorship, rehabilitation, and reintegration into society. And so this is a tool that we've developed equally between patients and healthcare professionals over the last 18 months to 2 years. And we feel it's particularly important as we emerge from the challenges that we've faced due to COVID. Next slide, please. The code has been translated into nearly 30 European languages. So it's really important that we have that reach right across Europe so that everybody feels empowered by the code. Next slide, please. It also, if we just take one example, and again, following up on what Gertrude said in relation to equal access, what we're saying is you have a right to equal access to affordable and optimal cancer care, including the right to a second opinion. And for each of the 10 rights, we've then provided 3 key questions that each cancer patient may choose to ask their healthcare professionals. So again, making it a very practical tool for the cancer patient. Next slide, please. And we've also backed it up by a lot of medical literature, but also evidence for the Code of Cancer Practice. You can see here, this is on the European Cancer Organization website. I'd particularly like to acknowledge Kathy Oliver and Peter Selby, who've worked tirelessly with me on this initiative, but also everybody who's mentioned there. And again, this was very much an equal partnership between patients and healthcare professionals. Next slide, please. So COVID-19 and cancer is a patient rights issue. And so as countries begin to emerge from the devastating lockdowns and the impacts that that has had on diseases other than COVID-19, and obviously particularly here, cancer, we feel that cancer patients' rights are absolutely more important than ever. So it's time to act, it's time to act now. It's time for patients to grasp their rights and to act in connection with these rights. And we're very happy to work with patient organizations in Malta to help them to really make the European Code of Cancer Practice a tool that will achieve the rights that you have highlighted. And again, just the European Code of Cancer Practice is for you. So very much looking forward to working with you on this. Thank you very much.
Thank you, Mark, once again. And now I would like to invite you to watch a short video clip followed by a video compilation. Thank you.
Don't let COVID-19 stop you
from tackling cancer.
Älä anna koronan estää syöpäseulontaa.
Il Covid non deve fermare la lotta contro il cancro.
Não deixe que a Covid-19 o impeça de enfrentar o cancro.
Ne engedje, hogy a Covid megakadályozza a rák elleni küzdelemben.
Не позволявайте на COVID-19 да възпрепятства борбата с рак.
La COVID-19 ne doit pas être un frein aux soins contre le cancer.
Laat COVID-19 u er niet van weerhouden kanker aan te pakken.
Laikas veikti. Neleiskime COVID-19 stabdyti mūsų kovos su vėžiu.
Nu lăsați COVID-19 să vă împiedice în combaterea cancerului.
Minä fisistin COVID-19 να σταματήσει από την αντιμετώπιση του καρκίνου.
Ne dopustite da vas COVID-19 spriječi u borbi protiv raka.
COVID-19 darf der Behandlung von Krebs nicht im Wege stehen.
Laat COVID-19 u er niet van weerhouden kanker aan te pakken.
Time to act.
It's time to act.
It is time to act.
Don't let COVID-19 stop you from tackling cancer.
Nie możemy pozwolić na to, żeby COVID-19 zatrzymał walkę z rakiem.
No dejes que el COVID te impida hacer frente al cáncer.
We can all make it a success and call time on cancer. It's time to act, for all of us, to act together. To find out how, go to timetoactcancer.com. Thank you.
So now we're concluding, and I would like to wish to convey our thanks to all speakers for their invaluable contribution and insights on cancer at such a difficult time. Sadly, the COVID-19 pandemic has disrupted our lives and created uncertainty for all, especially for cancer patients. I commend the European Cancer Organization for taking the initiative together with its member organizations to highlight that now is the time for us all, professionals, cancer organizations, and patient groups, to work in partnership with policymakers to address the impact of COVID-19 on cancer. On the 3rd of February of this year, the European Commission launched the European Beating Cancer Plan. The European Commission stated that the aim of Europe's Beating Cancer Plan is to tackle the disease pathway comprehensively, including prevention and early detection as key action areas. The other two key action areas are diagnosis and treatment and quality of life of cancer patients and survivors. The Beating Cancer Plan also takes into account health determinants, including education, socio-economic status, gender, age, and employment through advocacy and putting policy in place. I am therefore hopeful that the European Beating Cancer Plan will address the inequalities in cancer care and services across the European Union to ensure that everyone has free access to a comprehensive and quality cancer plan, including the most vulnerable. The Beating Cancer Plan also provides for the exchange of research findings between small and large member states and access to crucial health data. Here, the Emanuela Cancer Research Foundation, Malta, together with the teams of researchers who were awarded its grants, hopes to contribute to the sharing of a wealth of data across Europe. Together we can beat cancer, but as we heard today, we cannot wait to implement the Beating Cancer Plan for when COVID-19 is over. We need to act now. And here I end, and I would like to wish you all a good day. Thank you.
I would just like to add my words to Her Excellency. I think it's been a super day today. Thank you very much to all the speakers. I think you heard from everybody right across the space in relation to cancer services, cancer patients, cancer policy. It's very critical that we move together in this. What we've seen is that we need to act now. Cancer won't wait, neither should we. And the time to act is now. So please act. Governments, please act. We need your support and your help. We need to work in collaboration with you to deliver a better future for our patients.